we are going to have another session of our monthly webinar. Today, we are going to have a very important session in the current scenario, because today most of the students are mainly intended to do cosmetic procedures and cosmetology. So recently I asked my colleagues in the department, what about our students who have completed the course and started practicing? Are they doing well? Then all the colleagues told me that everybody is doing well, but most of the our alumni are doing mainly cosmetic practices. So that's good. It is the order of the day. But don't forget about the core strength or core intent of our dermatology. So whatever it may be, since you are more into cosmetic dermatology, we have planned to give a few topics on cosmetic dermatology. One such topic we are going to have today, the lasers and light-based instruments and procedures. For that, we have a very good speaker, Dr. Shruti Mohan. She had intensive training in cosmetology, especially the lasers in Mumbai. And after that, she came back and started her work in Calicut. And now she is a consultant cosmetologist and dermatologist. About Shruti Mohan, there are a lot of things I need to tell, but we have to start the webinar. Now, a few things. I mean, she was a very good student and bagged a number of prizes and awards during her career. The best is the most important is a research award instituted by the Kerala IADVL, Dr. B. K.H. Nair Memorial Award. Once she was the winner. It is a prestigious award which is given to original research work. Second is, as all of you know, that she won a thesis award, best thesis award. And that is also very prestigious award. It is an all India competition, and she was selected as the best, having done a very good thesis, and she was awarded the best thesis award. And like that it goes. Anyway, now it is time for us to hear from Dr. Shruti about the light and light-based treatment. Over to you, Dr. Shruti.
Thank you, sir. Thank you for your kind words. Just like sir said, our core thing is dermatology, but now this is the time when we need to learn more about lasers and how we can use them in dermatology also. So that is why today I'm here to tell you all about, to explain to you all about the lasers and other energy-based devices. It's a really vast topic. So I have included information which I think will be relevant to all of you PGs. And in the short time, I'll be trying to cover almost everything. So when we learn about anything, it's always interesting to know what happened or what's the history. So the first, thought or the first information about a probability of laser came from Max Planck and Albert Einstein. In fact, Albert Einstein had put up a research paper named as quantum theory, where he said energy is emitted and absorbed in quanta. That was the seed which led to the development of laser. Years later, Americans Townsend Weber and Russians Besov and Prokhorov, they found out not laser, but stimulated emission of radiation from microwave. Following that came the discovery of the first laser, that is the ruby laser. First, Theodore, he constructed the first laser using synthetic ruby, but Gordon Gould, in the same year, in the same time period, built his first ruby laser. And hence, Gordon Gould came to be known as the father of laser. Towns, Besov, and Prokhorov, who found microwave-assisted stimulated emission of radiation, they were given the Nobel Prize in Physics. And after that, by 1963, Leon Goldman started using lasers in medicine. And that is why he is known as the father of laser in medicine. After the ruby laser, so many lasers came, like helium neon, uranium, the lasers that we use now, alexandrite, Nd:YAG, Er.YAG, carbon dioxide lasers, and so on. Now, when we deal with lasers, I would like to, explain it in different subheadings. Like I'll be discussing the basics of laser properties, classification of laser, the indications, how to select the patients, pre and post-operative care, and regarding the other energy-based devices. Coming to the basics of laser, I'm taking you back to your chemistry classes. That is, this is everything you know. It's just a revision and explaining to you how laser is formed. So you all know when an electron is excited, it is given energy, it gets excited, it goes to a higher energy state. And when that electron is in the high energy state, that is a very unstable energy. That is a very unstable phase. It releases that energy and comes back to the ground state. So whenever that energy is released, that is not charged. And that released energy is called a photon. So in laser, what we do is we purposefully stimulate an atom, stimulate the electrons in that atom so that they get excited. And when they return to the normal state, when the electrons return to the normal state, they release several photons. And these photons have certain peculiar characters. That is, if one photon travels in a particular direction, all the other photons will travel in the same direction and in a parallel fashion. That is the advantage we got when we created laser machine. So in a laser machine, you need 4 basic components. One is a medium, which is either a solid, liquid, or gas, which is the source of these electrons. Next, you need a source of energy. You need mirrors at the end of laser, that is, to the photon that is created that keeps reflecting between the mirror surfaces. So the number of photons can be increased by these reflective mirrors. And finally, you need a delivery system through which the laser can come out. So this is the very basic diagram of a laser machine, where you have a lasing medium at the center, a pump source, and 2 reflective mirrors. The photons will keep traveling between these reflective mirrors, and the number of the photons will also increase. And one of the mirrors is partially reflective. So that will have an optical cavity, and through which the laser will be emitted out. I can't play this. I'll play this video at the end of the session. Now, this is the laser machine. And through this comes the laser. Now, once the laser comes out, still it can, to an extent, get scattered. So to prevent that, we have this articulated arm. And generally, this articulated arm has up to 7 reflective mirrors within it. So at each joint, you will have a mirror. So what happens? The laser beam that exits the optical cavity that we saw in the previous diagram, that again gets reflected through all these mirrors so that it is focused, and it causes minimal damage to the surrounding tissue. Now we said that the lasing medium could be solid, liquid, or gaseous. So the examples are like these. The solid ones are the crystals that we use, like alexandrite, erbium, doped, yttrium, aluminium, garnet. That is a erbium YAG. Then Nd:YAG, ruby lasers, KTP laser, that is potassium titanyl phosphate lasers. And you can also use, these are all crystals, which is a solid state media. They get, their atoms get excited and release electrons when you give energy. Now, gaseous form includes argon and carbon dioxide lasers, which are very commonly used. The liquid media are mainly used in case of pulsed dye lasers. We'll be discussing in detail in the coming slides. Now we have understood what happens inside the laser machine. Now once the laser comes out, now we need to know what is the quality of this laser, and that is the reason we use it in dermatology. The most highlighted properties of laser include monochromicity. It is monochromatic. The light that comes out is monochromatic. That is, it always travels in the same direction. Coherence, which means it is always traveling in the same phase. Monochromicity means it is the same, it does not have different colors. It has the same wavelength and the same color. Second is coherence, which means it is always in the same phase, in the same direction. And collimation means it is always traveling in a parallel direction. Now, these lasers, they always travel in this particular way that I said, but their intensity can be varied. Their intensity can be increased. That is, there are two different factors by which you can increase the intensity. One is by placing a lens, so that whatever wave is coming, it can be focused into a particular point. Second is by increasing and decreasing the diameter of the optical cavity. So the beam, the number of lasers that pass through the optical cavity can be adjusted. Now, these are certain terms that you always need to understand when you deal with lasers, because this is the term you use, and this is the term that you should have in your mind to set the parameters right to get the right results. So the basic things are energy, which is the fundamental unit of work you already know. It is measured in joules. The next important thing is fluence. Fluence is the amount of energy that is delivered in a unit area. This is the most important thing you need to take care when you are selecting the laser settings, because this affects the results. Higher the fluence, higher will be the energy that is delivered in that unit area. That means the energy density will increase when you increase the fluence. This is particularly important when you treat patients who have type 3 and 4 skin type, because they have a risk of getting pigmented. So when you give a high energy at a very high density, very high fluence, the risk of getting pigmented increases. So that is why knowing what is fluence is very important. Next important factor is the pulse width or the pulse duration. Longer the pulse duration, longer the contact of the laser with the skin. Shorter the pulse duration, shorter will be the contact. Okay. So this pulse duration is different. In case of continuous wave lasers, the pulse duration is wider, which means it will keep firing onto the skin for a longer time. Whereas pulse lasers like the Q-switch lasers, their short pulses are given at a very spaced interval. Next, the spot size, which I mentioned just before, that is the diameter of the laser beam can be adjusted so that you can regulate the quantity of laser that hits the skin. So to treat the tiny lesions, you can keep a small spot size, and to treat a large area, you can keep a larger spot size. Next is chromophore. That is another important thing you need to know. That is, you have a laser, it is hitting the skin, but what is it targeting? If it is not targeting anything, it will just burn the whole skin. So that is why lasers are created, so that they are absorbed preferentially or specifically by certain molecules, and that is called a chromophore. Next important term is the thermal relaxation time. That is, the basic mechanism by which laser acts is it generates heat in the tissue where it acts. And once the tissue gets heated up, within a certain time, its temperature gets reduced to 50% of its base temperature. That is called the thermal relaxation time. So when you want, especially in case of laser hair reduction, where you want to miniaturize the hair follicle, miniaturize the hair diameter also. In that case, before it before its thermal relaxation time is reached, you should give the next shot. Then you will get best results. So that is why you need to understand all these terminologies. Now, since we have gone through all the terminologies, let's see what happens when a laser hits the skin. There are 4 different possibilities that can happen. One, it gets reflected. Another, it can get scattered. Especially, this happens when you give a very high energy than that is required. Then what is required if you give a very high energy? This gets scattered by the collagen fibrils or the dermal connective tissue that is present. So the net energy that is reached to the target will be decreased, whereas collateral damage will increase. So that is why you need to understand what is happening when laser hits the skin. Okay, it can either get reflected, it can get scattered, it can get transmitted properly, and it can get absorbed, which is the purpose we want. It should be absorbed by the target chromophore. Now, I've been talking about all this targeting and chromophore things. Why is it important? Because of the theory of selective photothermolysis. See, first, when the lasers were introduced, especially the ruby laser, it was uh, mainly used for these vascular lesions, and they were targeting the telangiectasia or the portwine stains. But what happened? The full path till the blood vessel got burnt. That is what happened when they first used these lasers. So then they try to find out whether there is a chromophore so that the laser can target just a certain molecule, which and the other part of the skin doesn't absorb that light. So that then came the theory of selective photothermolysis, that is selective localized heating, and that is achieved by a combination of selective light absorption, which is done only one wavelength for one chromophore. That's all. And you give it at a pulse duration which is shorter than its thermal relaxation time. Only if you give it at a shorter time, before the before the heat is fully come back to zero, you give the second hit. That gives the maximum result and minimum side effects. This should be almost by heart to all of you. This is the electromagnetic spectrum, and these arrows, the labeled ones, argon, KTP, dye laser, ruby, alexandrite, diode, Nd:YAG, Er.BM:YAG, CO2. These are the most common lasers that we use in dermatology. And you can see that all of them, their wavelength falls in the visible light, near infrared, and infrared spectrum. Okay. The main chromophores are water, hemoglobin, and melanin. Now you can see that most of them, most of the waves, most of the radiations, KTP, ruby, diode, Nd:YAG, all of these get absorbed by melanin as well as hemoglobin. Whereas Er.BM:YAG and CO2 are preferentially absorbed by water. So there is something, if you are targeting a pigmented lesion, there you should use these lasers so that you can target on the melanin. If you are targeting vascular lesions, then also this KTP or ruby, alexandrite, those are the lasers of choice. Now, when you are targeting a very superficial lesion and you need to just ablate it, that is just remove it, like removing a freckle, removing a lentigen, or removing a small nevi. In that case, you just need to burn a very small area on the superficial layer of the skin. At that time, you can use Er.BM:YAG or CO2 laser, which is absorbed by water, so it will be absorbed in the superficial layers itself. So that is the basic of understanding all of this. Yeah, this shows the thermal relaxation time. See, the larger the size of the chromophore, you can see melanosome is very small, whereas thermal hair follicle is very big. According to the size, the thermal relaxation time will also increase, and the pulse duration can also be adjusted according to that. So just summarizing about how you can choose the laser parameters. One is depending on the, you will have an idea of how deep will the lesion be. So depending on the depth of the lesion, you have to select the wavelength of the laser. And you should also select the laser which will be targeting the chromophore you have in mind, okay, which is responsible for the lesion. Next, spot size. That again depends on the thermal relaxation time of the target. Pulse duration, that also depends on the depth of the chromophore. This pulse duration, spot size, wavelength, all of this not only depends on the lesion, it also depends on the skin type of the patient. As I said before, if it is a pigment, if it's a type 4 and type 5 skin type, the risk of getting post-inflammatory hyperpigmentation is high. So in those patients, you should be extra careful. You should always choose a long wavelength laser so that higher the wavelength, it will penetrate deeper. And the pulse duration or the duration for which it acts on the skin should be short. So long wavelength, short pulse duration will give you the effect and will not cause pigmentation, especially in these type 3 and 4 skin types. Next is, regarding the short pulse duration, that is where Q switching helps. Q switching means giving powerful shots at a very spaced interval, like in a nanosecond gap or a picosecond gap. These are the Q switch nanosecond or picosecond lasers. Now, lasers can be classified in very many different forms, but this is the most basic and easily understandable classification. You can classify it into ablative laser, non-ablative laser, and fractional laser. Okay. Ablative lasers are, as I said before, their chromophores will be water. So they will be absorbed in the superficial layer itself. It will cause a superficial burn. That's all. But wherever it hits, it will completely burn that area. So this should be used very carefully because they have a high risk of post-inflammatory hyperpigmentation. Next is the non-ablative laser. It includes erbium glass and Er.YAG lasers and erbium doped fiber lasers. These do not, cause any damage to the epidermis. It just causes its effect within the dermis. So, post-procedure redness or even the post-inflammatory pigmentations are very less with non-ablative lasers. And next is the fractional laser. Fractional laser means if I'll explain to you in the next slide. See, this diagram will help you understand better. Yeah, here. The first image is of ablative laser. The whole area is ablated or fully removed. Next is non-ablative laser. In the non-ablative laser, the epidermis is not affected, but heat is passed into the dermis, and that causes neocollagenesis, collagen stimulation, and tissue remodeling. Third and fourth one, you can see, cylindrical columns being created. Both are fractional laser. Here you can see there are microscopic treatment zones. It's called MTZs. Okay, this is created both in fractional non-ablative and ablative lasers. That is that you are able to see. Okay. Here in fractional ablative laser, including the epidermis, there will be microscopic treatment zones. That is spaced holes created in the epidermis with surrounding normal skin. So this normal skin will help in healing of the ablated tissue. That is the basic concept of giving fractional laser instead of the fully ablative laser. This is mainly used in case of acne scars, where you create a wound using this fractional ablative resurfacing lasers, and the wound heals on itself by the surrounding spared epidermis. And the final photo is that of non-ablative fraction laser. Here again, the laser is provided in a fractionated mode, but epidermis is not affected. This is generally used for skin tightening, like for the mild facelift and for collagen stimulation again. This is yet another classification. I had explained this already. It can be divided into a continuous wave laser or a pulse laser. Continuous wave means the laser shot will keep on coming and it causes maximum damage, whereas pulse laser is always preferred. Minimum damage, powerful shots at a spaced interval. Now, what are the indications of laser? Where all do we use lasers? The most commonly known indications are in skin rejuvenation, that is as an anti-aging treatment, then for scarring, acne, nevi treatment, pigmentary diseases, and vascular diseases. These are the main broad indications of lasers. Now we'll go into the specifications of each laser, which are all the important lasers. Okay. One is carbon dioxide laser. Its wavelength is 10,600 nanometer, 600 nanometer, and the lasing medium is gaseous. There are two types of CO2 laser. One is the full beam laser, which is the fully ablative laser, and another one is fractional laser. It's a fractional ablative laser. As we saw in the 4 photos, the first and the third one can be provided with CO2 laser. Its chromophore is water. As discussed before, it is generally used for all the superficial lesions. The full beam laser can be used to remove lentigine, nevi, freckles, whereas fractional laser can be used in scar revision, even for treatment of stretch marks. The only risk when using carbon dioxide laser is there is high risk of burns of the surrounding tissue and post-inflammatory hyperpigmentation. Now, these are the two probes. The first one that you can see over here, this is the pointed probe used for ablation, and this is the fractional laser. This is the mechanism of action and the result you get when you use fractional laser. First, microscopic treatment zones are created, and the surrounding tissue slowly helps in healing of this skin as well as the superficial epidermis. Coming to the non-ablative laser, that is Er.YAG laser. Its wavelength is 1064 nanometer. Now, there is a paradox over here, that is CO2 laser has the maximum wavelength, that is 10,600 nanometer, and Er.YAG laser is 1064 nanometer. So, according to the theory with the electromagnetic spectrum, the longer the wavelength, the deeper should be the penetration. But CO2 laser has 10,600 nanometer and its penetration is very less. Whereas Er.YAG laser has 1064 nanometer but has the deepest penetration in the CO2 laser has a wavelength of 10,600 nanometer and it should ideally penetrate deeper. But because it has a chromophore that is water, it is present in all layers of the skin, it will be utilized in the first few layers itself. So that is why the chromophore is also dependent, that also decides how far this laser can penetrate. So compared to all lasers, the most deepest penetration is for Er.YAG laser. This has a wavelength of 1064 nanometer. It has a lacing medium, which is a solid state lacing medium, neodymium doped yttrium, aluminium, garnet crystal, Er.YAG. Now, this can also be different types. It can be a continuous wave laser, Q switch laser, and pulse lasers. Okay. There is something special about Er.YAG laser. Its main chromophore is melanin, but again, it has a non-specific absorption by different other chromophores also, especially hemoglobin also. So it can be used to a slight extent for vascular lesions also. Er.YAG laser is preferred by everyone because it leaves minimum minimum side effects, very minimum adverse effects on the skin. Though the results are very slow, it doesn't cause much problems for your skin. And it can be used in any kind of pigmentary dermatosis, even to a certain extent for post-inflammatory hyperpigmentation. Some people who have melanocytic nevi, and also in nevus ovata, it gives beautiful results. It can also be used for skin toning, for those who want just skin rejuvenation for a function. For that instant glow, you can use Er.YAG laser. So these are the results of my own patients. One, he had a pigmentation over here since childhood. And this is a case of nevus ovata. After 3 sessions, she has shown this much improvement. But again, she requires further sessions. Next is a fancy thing that you all would have heard about carbon peel. Just kept this because you would be thinking, where does carbon peel come in? So that can also come in. It is again a special variant that is present within the Er.YAG laser. You can. It's just used for skin rejuvenation. You keep a carbon mask, and then it is uh, first heated with 1% laser, and then the carbon particle is blasted off. It shows it is used for skin rejuvenation, but as a treatment in a treatment perspective, it gives very good results, especially with the inflammatory acne. It helps in reducing the inflammation and all the painful papules and nodules when the patient has. Along with the intralesional injection given for the nodule, if you give this carbon peel treatment, it reduces the inflammation drastically. But the laser that you use is Er.YAG laser itself. Next, coming to Er.YAG laser, though it is, when you read it, it is similar to Er.YAG, but the function is all similar to CO2 laser. Its wavelength is 2940 nanometer, which is in the infrared region. Lacing medium is again solid state lacing medium, but it's chromophorous water. So that is why it behaves similar to the CO2 laser. And the main thing is photothermolysis. It provides heat and damages the target tissue. So its uses are also similar to CO2 laser, skin resurfacing, photo damage, and Er.YAG laser also has, if you remember the electromagnetic spectrum, where we read that Er.YAG laser also has an attraction towards hemoglobin, so it can be used for correcting telangiectasia and rosaceas also. Coming to the pulse dye laser, this is the main vascular laser that we have, and its wavelength is between 585 or 595 nanometer. This is the only laser which has a liquid state lacing medium, which is the organic dye rhodamin mixed in solvent. It's chromophorous hemoglobin. All the other lasers, including Er.YAG laser, it only has a non-specific absorption by hemoglobin, but pulse dye laser is definitely targeting hemoglobin, and it was created itself, or it was made itself to target all these port wine stains, spider nevi, and melasma. Even melasma, the vascular component of melasma can be treated with pulse dye laser. See, you can see the improvement of even this minor telangiectasia. There are different types of lasers that can be used for vascular diseases. One is the pulse dye laser, which is the most common one. Another thing is KTP, which has a wavelength of 532 nanometer. Er.YAG laser, yes, does give a very mild result, but you need to give multiple sessions. Now, when this Er.YAG laser, when you have an Er.YAG laser machine, you can set it into the 532 nanometer setting also, which is a frequency doubled Er.YAG laser that can also target hemoglobin. So you can use either a pulse dye laser or 532 nanometer Er.YAG laser, which is a KTP technically. KTP means potassium titanyl phosphate laser. Okay. Both of these are really good with vascular diseases. But though they are targeting hemoglobin, they have got a wide variety of side effects. That is, KTP lasers and pulse dye lasers have a high risk of putting pigmentation problems, either a hypopigmentation, depigmentation, or hyperpigmentation. And sometimes, always when lasers are provided or laser shots are given, there should be 10% overlap between each shot. If the overlap is not provided, then there will be persistent footprinting, as you can see in this image. It does give good results, but you should be very careful when you use it. Next, coming to the diode laser. Diode laser is most famous for laser hair reduction. There are different wavelengths, means all the visible light spectrum lights and infrared spectrum light radiation can be used to generate diode laser. So there can be very wide variety of wavelengths. And usually a semiconductor is used as a lacing medium. its chromophore is actually not water, it's melanin and hemoglobin. And its mechanism of action is photothermolysis, just like Er.YAG laser. And the main use of diode laser is for laser hair reduction. It gives very amazing results in hair reduction because diode laser has a combination of 3 different wavelengths. So when all these wavelengths act on the hair follicle, there is definite chance that there will be permanent miniaturization of the hair. Again, its chromophore is melanin, and we are targeting the outer root sheath stem cells of the hair follicle and also the dermal papilla. So that is why you don't get a permanent laser hair reduction with just one sitting, because you need to keep giving shots at regular intervals so that the dermal papilla, with recurrent heat-induced damage, it will cause miniaturization of the hair follicle itself. Something you need to take care when you do treatments like laser hair reduction is its chromophore is melanin, so it can also be absorbed by the by the epidermis. So especially in the pigmented skin types. So in that case, you should cool the epidermis first. All these lasers will have a metal plate which is having a cooling surface. So you should actually treat that area before giving the passes. You should just rub it over the area and then give the shots so that the epidermis is saved. Next thing is tattoo removal. Tattoo removal is yet another beautiful indication of laser. First, this tattoo removal was done by dermabrasion. Microdermabrasion was tried, and then excision of the excision of the tattoo was attempted. But all of this caused, when you remove a tattoo, you get a scar. That was the result always. Then came this Er.YAG lasers, especially you switched ruby, alexandrite, Er.YAG, and KTP lasers. In India, ruby and alexandrite are less commonly used because they have a risk of pigmenting the skin. So they are better used in the skin type 1 and 2, whereas Er.YAG lasers are safer in the Indian skin type, even 3, 4, 5 skin types. So in case of tattoo removal, laser is selectively absorbed by these tattoo pigments, and that gets destroyed. But there is another problem that dermatologists noticed when they treated tattoos with Er.YAG laser. That is, once the tattoo pigment is removed, there is a scar, but that is not caused due to the treatment. But patients always say that it is because of the treatment that they got the scar. It is not because of the treatment. It is because when the tattoo is injected, during that process, the skin gets scarred. And when you remove the pigment, the scar becomes visible. So then attempts began to treat the scar also. And now the best treatment option is giving one pass of fractional CO2 laser, which creates microchannels in it that helps in scar revision. After that, laser, Q-switch laser is passed. One pass of Q-switch laser is given. So this helps in increased penetration of the laser also. Yet another good technique is R20 technique. That is, whenever you give laser to the tattoo area, there will be one area which gets frosted immediately. The immediate adjacent area will remain refractory, or that area won't receive the laser. So what you do is give one pass of laser, wait for 20 minutes so that the frosting will settle, and give another pass so that none of the area is missed. This gives better results. However, when you treat the tattoo, there is always a chance for the ghost of the tattoo to remain. Now, there are some new indications that has been found for lasers. That is, this is something interesting I found. It is used for treatment of onychomycosis. That is, patients were given treatment with itraconazole, 200 milligram for a week, and repeated monthly for 3 months, the usual regimen. And simultaneously, a set were given laser, Er.YAG laser, 530 nanometer Er.YAG laser, that is the KTP laser, given into the subungual hyperkeratotic area. That showed better results. So this is another indication that is coming up, and FDA has approved this as a treatment for onychomycosis. Other treatment modalities are combining laser with to increase the drug delivery, like especially in keloid. You can give a pass of fractional CO2 so that channels are created, and then you can give the active ingredient. It can be triamcinolostimide or even trifluoroacetic acid 20% has shown improvement in keloid. Botulinum toxin and 5-fluorouracil, all of these has been used and has given good results, especially in the treatment of keloids. Next, regarding skin rejuvenation and anti-aging treatments, there are wide variety of injections available, like skin booster injections, giving hyaluronic acid injections. Laser combined with these injections always give a better result, better hydration and better skin rejuvenation. So these are the latest uh, treatment modalities regarding laser. When you think about treating a patient with laser, there are certain things you should keep in mind. Some won't respond so well. One is definitely the skin type that you should keep in mind. The settings of the laser highly depend on the skin type of the patient. Other factors include wound healing. Those who have the habit of smoking or alcohol use, or those who have diabetes mellitus, their wound healing will be naturally delayed. So in such patients, when using laser, you should be a little cautious because their improvement will also be delayed. And especially if you're doing ablative lasers, the risk of pigmentation is higher in them. So you may have to give them vitamin C tablets or something to improve their wound healing. Now, patients who have a history of connective tissue disease, their disease can get exacerbated. Patients who have vitiligo, they can get cauterization. Those who have family history or personal history of vitiligo, you should be extremely cautious when you're doing procedures on them. Another is patients who are on isotretinoin therapy. When they are on isotretinoin therapy, better to avoid any other treatments, including lasers. And after 6 to 12 months of stopping isotretinoin, you can do the laser treatments. Also, if you have any infections on the site where you're planning to treat, avoid doing lasers. Now, what is the preoperative care you need to give? One is if the patient has a history of herpes simplex virus infection, give the antiviral prophylaxis. Another thing, give topical anesthesia. That is the only thing that you mainly need before a laser treatment. That is the eutectic mixture of local anesthetic. It can be applied for 30 minutes to 45 minutes, and by the time the area will be numb, and then you can treat. Another most important thing is most common side effect or most common complication that you see with laser treatment is eye injury. So always you also should wear proper eye protection. The patient should be also given eye shield, and in case you are treating the periocular area, then use an intraocular eye shield. Now, once the procedure is done, for all the non-ablative lasers, there will be just mild edema or mild erythema. That is all, which will settle within a day. So you just need an anti-inflammatory cream, a mild steroid, even desonide will be sufficient. Provide it, ask the patient to apply it twice daily just to decrease the inflammation. That is all. Otherwise, you don't need so much of post-operative care. The main care that you require is when you do ablative lasers, especially the fractional CO2 lasers. There can be intense edema, burning sensation, and even fluosanguineous discharge. So the patient should always be given topical corticosteroid, and in case you feel the discharge is too much, you can also give antibiotic so that it doesn't get secondarily infected. So these are the main things that you need to understand about lasers. Now I'll be discussing the other energy-based devices other than laser. The most common ones are, one is radio frequency device, another is high intensity focused ultrasound, which is HIFU. Next is HIEMT, which is high intensity focused electromagnetic stimulation, and cryolipolysis, cool sculpting. So coming to each of it. One is radio frequency. We learned the principle of radio frequency. It is similar to the non-ablative laser. It is a non-invasive skin tightening technique. Just epidermis is not affected, we just pass heat waves into the dermis so that neocollagenesis is stimulated, neoelastogenesis is stimulated, and wrinkle reduction occurs and tissue tightens. There are two types, monopolar and bipolar. Monopolar, you will have a grounding plate also, whereas bipolar, you will have two electrodes between which the RF is conducted. And the farther the distance between the electrodes, the deeper will be the penetration. This is how you actually perform RF, radio frequency technique. You always give a pull in a directional pattern so that there is a phase lift. It is not as easy as you see here because the speed, the energy that is delivered is all important. Otherwise, it can leave burns. Okay. So the energy setting all should be tolerable to the patient always. And the techniques, when you do all these procedures, there are techniques and you should take special care. You should not press it on the same area. It will cause burns. Okay. It is, when used properly, it gives good improvement in the wrinkles and smoothens the skin texture also. This also just requires a pre-procedure anesthetic cream application and has minimum downtime. No minimum downtime, no erythema at all. The only thing is you should be cautious while you are doing the procedure. And for mild skin laxity and mild face cellulite, even for under eye bags, you can use radiofrequency as a very good treatment option. Next three, that is HIFU, HIEMT, and cryolipolysis. All of these are used for body contouring. That is, wherever you have stubborn areas of fat, that can be decreased by all these techniques. First, coming to HIFU, which definitely requires a dermatologist to do the procedure. HIFU is high intensity focused ultrasound, which means you are using the ultrasound waves to cause ablation of subcutaneous adipose tissue. It has various, you can see on the right side, you can see the probes. See, depending on the size or the number of the probe, the depth of penetration, it differs. Means if you use a 4.5 mm probe, it penetrates up to the subcutaneous tissue, and that is mainly targeting for fat reduction, especially for the double chin area and those who have a very chubby cheek. For reducing the fat in that area, you can use that probe. The other two probes are mainly used for skin toning, that is for fine line reduction and the minor wrinkle correction and minor sagging of the face can be corrected with the other two probes. So that is the main indication where you use HIFU, jawline shaping, double chin correction, and this HIFU can also be used. The probe will be different, but that can also be used for abdominal fat reduction. Those who have sagging breasts, their chest wall can be pulled up so that the breast sagging is treated. Okay. When you're using HIFU, there are certain no-go areas. That is, because it's targeting the subcutaneous tissue, there are several nerves going through it. And here also you have the vocal cord. So the midline is always spared. Midline is like a no-go zone when you're treating with HIFU. Also, the nasolabial folds are avoided. The preauricular area is avoided where you have the auricular nerve. Okay, so those are the things you should keep in mind when you're giving a HIFU treatment. But it gives really good results with scars, with this wrinkles, and those who want a jawline shaping, they can also get a good improvement. But all of these methods are just anti-gravity, just giving a full anti-gravity. So you need to repeat it once in 2 years or so. Now these are fat reduction techniques like HIEMT and cryolipolysis. In HIEMT, you are providing nothing but electromagnetic stimulation, and using that you actually stimulate. It is equivalent to a workout. Means just like a workout, this energy is provided and it causes muscle growth and also burns fat. All the stubborn areas of fat, as you can see in the photograph, the lower abdomen, even the arms, thighs, love handle area, there is the flanks. All of these areas, when you have stubborn fat, or if there is a patient who has a spine problem, they can't go for workouts, then also this is an alternative. In HIEMT, we use electromagnetic stimulation, whereas in cryolipolysis, we are using cooling. Cooling is the method, that is popsicle paniculitis is what is the fancy name for this kind of cold-induced paniculitis we induce on the fat, especially in the lower abdomen area, where even after several workouts, they don't have a proper six-pack ab or toned in ab, then you can use cryolipolysis as a technique. It is just that area is pulled up, it is frozen, and there will be mild erythema and even induration on that area. Slowly, fat in that area will get. There is actually we are creating a paniculitis and causing fat necrosis. Generally, it does not have any long-term side effects. Just immediately after the procedure, there will be mild erythema, and within a few days, patient will have a dull aching pain in the area. That is all. But when you're doing this treatment of cryolipolysis, you should be cautious. You should avoid it in patients who are already on blood thinners like aspirin and those who have cryoglobulin, because it may cause clotting or diffuse bleeding in the area or clotting. Now, regarding all these body contouring treatments, whenever you're giving body contouring treatments, what you should take care is all the ornaments, metal implants that should be removed before giving these procedures. And always, especially in case of radiofrequency treatment and HIFU, where we are doing the treatment, always do it at a temperature that is suitable or tolerable by the patient. Okay, that gives optimum results. And always know the no-go zones and avoid entering into those areas. These are my references. Thank you.
Wow. It's a wonderful talk, Dr. Shruti.
Thank you, sir.
You have started from the very basics and advanced through advances. And I like the talk because you have given a lot of practical tips. And that is important for the beginners, since you have been doing it and it comes just like that. But for a beginner, they should know these tips beforehand, and then they have to use it and regularly, and then they have to master it. So that is the beauty of your talk. Congratulations.
Thank you, sir. Thank you so much.